Absolutely. Good morning, everyone. So happy you are joining us today. Sorry, let me just get myself situated. Good morning on this Friday, and Samantha and I are just thrilled that you're here. The whole Mid Atlantic Arts and Education crew are just so thrilled that you've joined us today. My name is Jamie Dunlap, and I serve as the Chief of Creative Catalyst and Lifelong Learning at the Pennsylvania Council on the Arts. Just a quick heads up for everyone attending today's webinar. It will be recorded. And we are just really excited to highlight all the opportunities and resources in arts and health environments. And we'll be able to share then this recording after for those that would like to refer to things you heard today or for those that couldn't join us. I am joined today by my neighboring colleague from New Jersey, Samantha Clark.
Hi, thanks so much, Jamie. My name is Samantha Clark. I'm the Program Officer for Arts Education and Lifelong Learning at the New Jersey State Council on the Arts, and my pronouns are she, her. This webinar is presented by the Mid-Atlantic Arts Education Managers Working Group and our partners at the National Assembly of State Arts Agencies. In addition to Pennsylvania and New Jersey, the Arts Ed Manager Working Group is a collaboration between arts education managers from the Mid-Atlantic State Arts Agencies, which include Delaware Division of the Arts, Maryland State Arts Council, New York Council on the Arts, Pennsylvania Council on the Arts, DC Commission on the Arts and Humanities, the Institute of Puerto Rican Culture, Virginia Commission for the Arts, the Virgin Islands Council on the Arts, and the West Virginia Department of Arts, Culture, and History. And some of those arts education managers are in the chat now. Thank you so much for joining us today. We're so delighted to have you. Before we get started, please take a moment to familiarize yourself with the Zoom webinar platform. There are auto captions available, which you can access by clicking on the Show Captions button on the bottom of your screen. And I think if you're on a tablet, it's most likely on the top of your screen. In the Zoom webinar format, the audience will be able to see and hear the presenters, but you will not be able to see your fellow audience members. However, we do invite you to engage in the chat for dropping down themes, ideas, things that really resonate with you during the course of the webinar. Please use the Q&A feature for any questions for our speakers today. The chat will be used for resources and connection, but questions that you want answered should be posed in the Q&A option. Questions posed in the chat may be missed, so definitely use that Q&A feature. And that feature can be found again in the toolbar at the bottom of your screen.
Well, I am absolutely thrilled to present to you our featured artist for today's webinar, Lady Breon. Just a little bit about our artist today. Lady Breon is an international spoken word artist, activist, organizer, and educator. She currently serves as the executive director of the Black Arts District, an organization she founded in 2019. And in 2024, she was appointed by Governor Wes Moore as the Poet Laureate of Maryland, which made her the youngest poet laureate in Maryland's history. Awesome. And the only spoken word artist to ever hold this position. Also awesome. She received her BA in Communications and Culture from Howard University and her MFA in Creative Writing and Publishing Design from the University of Baltimore. During her slam career, she won the 2016 and 2021 National Poetry Slam, the 2017 and 2019 Southern Fried Regional Slam, and the 2019 Rust Belt Regional Slam. In 2021, she became the Woman of the World Poetry Slam champion, making her the #1 ranked woman slam poet in the world. Amazing. And even more amazing that you're with us today, Lady Breon. The poems she's going to be sharing with us today connect to and are inspired by the topic of today's session, which is arts and health. Just wanted to say I had the privilege of hearing Lady Breon present at the NOAA conference, which is National Organization of Arts and Health. And that conference was in Baltimore a few years back. And her words and stories that I had a chance to hear that day still sit with me. And I am just so thrilled that you all have a chance to hear from her too, And so with that, I'm going to pass you the virtual mic, Lady Breon, and thank you very much for being here.
Thank you so much, Jamie, for that warm introduction. I'm super excited to be here. Thank you, everyone who made it possible for me to share with you all this morning. It is rainy in Baltimore, but I hope there is some sunshine and goodness in everybody's day today. So again, I'm Lady Breon, and today I'm going to do a poem that I wrote about my mother called Sugar Cane Smile. And I think it dovetails well with this topic around art and health. From a personal experience, I remember learning about sort of the gravity of my mother dealing with diabetes. We were at the hospital, and like many, she was sort of in denial that what she was experiencing was related to her challenges with diabetes. And I remember just trying to support her, but also as being her daughter and not her caretaker, like it was just a contentious battle. And I remember just going to the parking lot of the hospital and writing this poem as my own way of sort of processing what that moment was like. And so in the poem, you'll hear themes about very nostalgic themes and food-based themes, because as you know, diabetes is certainly related to your sugar intake, right? And what I recognize is particularly in the Black community where diabetes is so prevalent, like we do everything over food. And so I was grappling with, both sides of this story where I'm so grateful for all the memories that are related to food and family, but also recognizing that it's having this debilitating effect on both my mother and many of my aunts in my family also struggle with diabetes. And so I will say before I get into the poem, my mother is doing a lot better. She is not still in the place that she was for this poem. She went vegan and lost weight and did all these holistic practices that really helped her. But I still choose to do this poem because I recognize this story is still true for so many others. And it's a point of connection, which I think many of us as teaching artists serve to create that empathy and humanizing experience with our artwork. So that's my story. I'd like to share my poem now, and I hope it speaks to someone on the Zoom call today. Here we go. Sugarcane Smile. My mama got a sugarcane smile. Southern sweetened iced tea, hint of lemon in her kiss. My mama loved me like home cooked meals, slow roasted conversations, leftovers in the corners of my mind like I remember. She gave me cheese curls like teething rings to place between my gums and satisfy my crying. She Twizzler twisted my thick hair with globs of blue magic, make me Sunday fresh. My skin hot fudge, sheet caramel at best. My mama got skin like Raisin Bran, where moles decorate the flakes of her melanin. My mama, cornbread and cola, candied yam and cabbage, banana pudding and cobbler, food so good on the taste buds, it make her feet swell. She wobbles sometimes like the pendulums on grandma's clock that do tell time. Learned it from all the times great grands was cooking for church's second service. Learn to praise God through baked mac and cheese and pray. My daddy come home from the service, but he dead and gone now. And my mama in combat mode, her body covered with infections like chocolate coated candies, sugar level 501, which is to say, she got stroke caught in between her teeth, A1C 14, veins constricting, then collapsing like salivating glands. When you taste that cheesecake that's too rich and saccharine, my mama so sweet, it's sickening. They had to cut sis from out her breast like she had cavities within her chest, and I'm scared, y'all, that if she don't water down the syrup in her spirit, they will amputate her limbs and ligaments, leaving her bitter to the taste. Oh, sour in the face, where salty tears replace the stars that twinkle and burst in my mama's iris. My mom is hot cocoa when my soul grows cold from all the pain in this world. All gummy bear dimples and a heart made of pecan swirls. My mama, she got a crock pot type hug, the type that fills the house with aroma. My mama fill me up every time I'm around her. My mama is a recipe passed down through generations. And I just pray my children will have full plates before she is called to grace. Amen. Pray her eyes will not be candied wrapper shut before she ever has a chance to meet them. But my mama, she be stubborn like Jawbreaker sometimes. So I sit waiting, making pools of apologies, hoping she will forgive me enough to take care of herself, because this ain't no Candyland's child's play. And though disease is hard for anyone to swallow, this ain't no sugar pill placebo, because we know diabetes, it will not just go away, but still. My mama be like, baby, everything gonna be okay. My mama with her smile made of sugar cane, as I just can't help but fear her decay. Thank you all so much for listening.
That was beautiful. Thank you so much for sharing that. That was wonderful. What a treat for us on this gloomy, dreary Friday. As you said, it's raining here in Harrisburg, Pennsylvania too, just an hour and a half north of you. So yeah, that was just wonderful. Thank you. Yeah. Well, I would like to now invite our two speakers to join us, and I'm going to do just a quick intro to our two speakers for today. And let me just pull up my information. Thank you. So we'll start with, so sorry, forgive me. We are going to start with Claire. So I've known Claire for quite some time, also based in Pennsylvania. Claire has served as the founding director of Center Stage Arts and Health and the director of the Dr. Keneal Center for Humanistic Medicine at Penn State Health and Penn State College of Medicine for almost 15 years. She had helped found the National Organization for Arts and Health in 2016. That was the conference that I attended, the NOAA conference, where I had a chance to meet and listen to, for the first time, Lady Breon. And she served as its second president for the NOAA organization. Some of her focus areas within the field of arts and health include best practice sharing, funding structure, evaluation strategies, and artists in health training. So in September of 2024, Claire transitioned to a full-time work in her own capacity as Arts and Health LLC. Her current projects include directing an international film festival, facilitating art exhibit opportunities for refugee and immigrant communities, and developing arts programs for senior populations. So we are thrilled to have Claire with us today. In addition, we have Ali Meyer-Lokuta, and she is the Assistant Vice President of Arts and Wellbeing at the New Jersey Performing Arts Center, or NJPAC, where she leads innovative research, evaluation, education, and programming at the intersection of arts and health, serving communities in Newark and New Jersey. She is a co-founder of NJPAC Rutgers Arts and Health Research Lab, and is leading the first arts prescribing program in New Jersey in collaboration with Horizon Blue Cross Blue Shield of New Jersey. Prior to this role, Ali was the inaugural Assistant Director of Arts in Medicine and Arts Program Manager for NYC Health Plus Hospitals on the advisory task force for their first social prescribing pilot in the US, Culture RX, out of Massachusetts. I think many of us are probably heard of or are familiar with that program. And then finally, co-author of the Arts on Prescription Field Guide, a multidisciplinary artist. Ali stays well through creating visual art and writing. We are so thrilled to have both of you join us today. Your wealth of expertise and knowledge is going to be a treat for everyone, and the teaching artists here will have a chance to hear from you on how they can prepare themselves to be engaged in a multitude of wellness-based environments. So we have made sure, as I believe Samantha said at the beginning, that we left some time at the end after Ali and Claire's presentations for Q&A. So we'll be monitoring the chat, but we'll wait until the end to have that opportunity to ask questions. So with that, without further ado, I should say, Ali, we are gonna begin with you. And then Ali, when you're done, you can just pass it right over to Claire, and we'll go from there. Open the floor for questions after that. So thank you, and I will send it to you, Allie.
Thank you so much, Jamie, and good morning, everyone. Wow. Thank you to Lady Breon for sharing that poem and storytelling with us today. My role here is to give you a bit of an overview and grounding for the field of arts and health and what this work is, but there's no better way to kind of know it than by experiencing it. And really, that poem and it was a perfect example of both how, Lady Breon shared that was like her way of processing something that she was going through the act of writing the poem. And then the content of the poem is really such a wonderful example of how art can have a public health message, right? By tying these themes of food and diabetes and culture into the poem itself. So just really want to reflect back on and thank Lady Breon for opening us with that. So yeah, I'm going to go into a little bit of an introduction of what arts and health is and a little bit of examples of how teaching artists are involved in this work at NJPAC, and then pass it over to Claire to talk a little bit more about what what the experience is like as a teaching artist in arts and health, and the kind of specific considerations that one needs before or as you approach engagement in this work. So you can go to the next slide. So just for Samantha's sake, as you move through the slides, like a couple of them I really are just statement pieces. So arts and culture are public health. And you can go to, and arts organizations are community health organizations. These are some of the grounding statements that, are foundational to the practice of our work at NJPAC and for the field as a whole. But what do these statements really mean? I always like to start with defining health, right? So the World Health Organization defines health as a state of complete physical, mental, and social well-being, not merely the absence of disease and infirmity. And I really like to kind of hone in on the fact that it's not just the absence of disease, but the presence and the opportunity to be well. And across these three domains, we think a lot about physical health. Mental health is certainly rising to the top of our discussions now, but we sometimes leave out the piece of social health where the arts can really be a significant driver. And so to be healthy, to be well, we need these opportunities to thrive beyond sickness, right? So I'd like you to think for a moment about what well-being means to you. And Samantha, you could go to the next slide. And maybe let's just take a moment for everyone to put in the chat, what does well-being mean to you? What does it mean? What do you need to be well? And we'll leave a moment for everyone to put their answer in the chat. Peace, safety, joy. Thank you, Esther. Joy, a sense of ease. I love the word ease. Rest, a clear head, community, harmony, vitality, contentment, happy, healthy care and support, balance, access to resources. Keep it coming. Thank you so much for sharing. As you continue to share, I want you to now think about a time when you've engaged in arts and culture. Maybe you've felt uplifted after witnessing a concert, or calmer after visiting an art gallery. Maybe you felt energized and in community at a dance class or choir practice, or more peaceful after reading a book of poems. Thanks, Samantha. We've been doing this forever. Arts and health often is kind of described as a, quote unquote, new field of practice, but really it's a sense of kind of remembering and reconnecting ancient ideas of ritual, meaning making, playfulness, belonging through the arts. You know, humans have always used the arts and creative expression to do all of this. And, you know, I've heard it said that if it wasn't good for us, we probably would have stopped doing it by now, right? Um, but now we have also, you know, along with the sense of intuition that the arts are good for us, a really rigorous and deep evidence base that shows that the arts are good for our health across cultures, across disciplines and modalities, and across the lifespan. So we can advance to the next slide. So this is a bit of a Cliff Notes slide for some of the evidence base that we've seen kind of progress over the last 5 to 10 years. This stat is always, you know, making kind of headline news, but going to a museum just once or twice per month has a similar protective value to your health as exercising for an hour or two per week. So any, you know, doctors in the room will always say, you know, don't stop exercising. And of course not. But in the same way that we've come to kind of understand that exercise is good for our health, how can we, like, as a society, as a culture, come to understand that actually arts participation is good for our health too? We see from early childhood through youth, adulthood, and older adulthood, with increases in arts participation, we see increases in flourishing, well-being, life satisfaction, social cohesion and self-efficacy, and lower loneliness, depression, substance use, cognitive decline, and early mortality. So that leads us to say that taking part in the arts is a positive health behavior. So what are some other positive health behaviors? And maybe you can put these in the chat too, make this, you know, interactive. I think of brushing my teeth, right? Brushing your teeth is a positive health behavior. It's something you engage in daily as a way of, you know, making sure you have good dental health. Getting good sleep is a positive health behavior. Wearing your seatbelt is a positive health behavior. And so what would it be like for us all as a culture, as a society, to understand that actually getting a daily dose or a weekly dose or a monthly dose of arts and culture is also good for our health? You can advance. Yes, thank you. And so what do we need to be well? Well, if we understand that arts participation is a positive health behavior, then we all need access to arts and culture. You know, up to 80% of our health is actually defined by factors that are non-medical, social determinants of health. And you can go to the next slide, I think. So this includes our access to safe housing, food, employment, education, transportation, safety, clean air and water. It's really the environment in which we live, work, and play. So if the arts are a positive health behavior, and that means access to the arts is a social determinant of health. And here in the US, over the last kind of couple of years, and especially the last few months, there's been a lot of kind of talk about social prescribing or arts prescribing. So I'd like to just kind of do a quick overview of the kind of defining social prescribing and why prescribing or incorporating arts into those prescriptions is important. So social prescribing is a practice that enables health and social care providers to connect individuals with all of those non-clinical supports and community resources that address individual and community needs based on those social determinants of health. This happens all the time now with community health workers, either hospital-based or community-based social investment and community impact programs, where people are connecting patients with those kind of wraparound resources, right? So understanding, as Lady Breon was speaking to earlier, that actually the types of food we eat really impact our health. So making sure that people have access to healthy, fresh foods, that our housing impacts our health. So making sure that people have access to safe housing, that education impacts our health. Are you educated to the highest degree that you want to be? community health workers are actively connecting people with these resources. Here in the US, what's left out of that kind of holistic equation is arts and culture, time in nature, or volunteering. Those aspects are incorporated in pilots or programming like this internationally. So arts prescribing is a way of including those factors in the tool belt of tools and resources for these community health workers or clinical workers to be able to include arts and culture in those referral processes. You can go to the next slide. And arts prescribing really allows for a broader conversation. So as a community health worker asks, what don't you have that you may need? They can also ask, what brings you joy? What is something that you and your family might want to do together? Let's connect you with something creative in your community. In pilots that I've been a part of, I've seen mother and daughters go to concerts together, partners trying out a glass blowing workshop, friends attending a crochet class at the library, or an individual trying piano or guitar lessons for the first time. So arts prescribing recognizes that even in the midst of struggles, we all have a human right to feel joyful, creative, and make meaning of whatever we're going through. So, next slide. All that I've touched on so far really falls into the field of arts and health, which recognizes the integral nature of the arts to our health and well-being. So like we were talking about earlier, just like everything else that we've come to know culturally are good for us. Exercise, getting your 10,000 steps, eating your greens, the arts are good for our health. So this field of practice, research, and education is diverse and multidisciplinary and integrates arts, culture, and creative expression into a variety of healthcare and community settings to enhance health and well-being. I think that's the next slide. Yeah, just the definition there. And on the next slide, you'll see the socio-ecological model for arts and health, which shows the many domains that we see the influence of the arts, all the way from your personal arts practice through healthcare spaces, education, community, and public health in these kind of concentric and overlapping circles. So whether you are singing in the shower, integrating the arts into your healthcare system, your school, your community center, or writing policies that integrate arts into public health, we know all of this has a positive impact on individual, community, and population level health. And so often when I'm talking about this to artists or arts organizations, there's kind of a twofold lens through which to look at this. One is that just keep doing what you're already doing, by the very nature of the work that you're putting out in the world, by being a teaching artist in your community, in your school, at your local art center. What you're doing is a healthful practice for the individuals and communities that are engaging with you. And there's opportunity for intentional practice, for programs to be developed at the intentional intersection of arts and health with specific health or community health goals involved. And to engage in that, sometimes you need a specific training around a scope of practice and boundaries and ethical practice to make sure that you're keeping yourself safe and the participants that you work with safe too. So yes, so you can, what does this mean for teaching artists? Number one, you can pat yourself on the back, right? Whenever you're engaging in your own creative expression, please know that you're doing something good for your health, to keep it playful, to keep it expressive, and to know that you're engaging in a helpful behavior. And that as you help others access their creative selves, you're helping them engage in a health behavior. So you're making their lives a little bit healthier too. And now there's also opportunities to seek out training and programs that explore arts and health at this intentional intersection. So I'll go over briefly just some opportunities, some specific examples in which we employ teaching artists at the New Jersey Performing Arts Center in our arts and wellbeing programs. I'll talk a little bit about kind of the depth or breadth of training that the teaching artists kind of need before getting started in any of these roles. So the first set of programs I'll talk about is in healthcare environments. So these are programs that we produce in partnership with RWJ-Barnabas Health System, where we're placing artists in the healthcare environments. So one program that we have is called Artists in Residence. And so these are individual artists working one-on-one at the bedside with hospital patients. These teaching artists, go through specialized training to be able prepared to work in hospital environments with patients, and they go through specific training both from an arts perspective and from a health perspective. So they go through the volunteer onboarding process at the hospital themselves. They learn about HIPAA, patient information protocols, patient safety protocols, what does signs mean on the doors when there's, mask and glove precautions or droplet precautions. And Claire will get into this more specifically. Being a hospital-based teaching artist isn't for everyone, but for some, they quite find it a really meaningful addition to their teaching artist practice. Hospital-based performers are our kind of music in the lobby performers or Culture Connects performers, which perform in public spaces. And so these artists do not receive specific teaching artist training, but we do have, genre and song list considerations for performing in hospital spaces. So, there's kind of lyrical considerations and cultural considerations around what types of programming they provide. So we have also a couple programs that are more community-based, and these include our Lullaby Project and Ritual for Return. In the Lullaby Project program, which was developed out of Carnegie Hall, songwriters and composers work one-on-one with new or expecting mothers and families to compose personalized lullabies for their babies. This also involves special training for these artists. You're working over a period of 6 weeks, helping the family or mother with creative writing prompts and songwriting prompts. And these situations can get quite deep and emotional and produce a product that is quite beautiful. But to have that kind of boundaried practice, ethical practice, and scope of practice, and make sure that it's not getting into a realm of clinical or mental health practice is really important. And so our teaching artists go through training before starting the program, and then ongoing training to keep up with kind of the latest opportunities. Ritual for Return is a program that uses theater and storytelling over 12 weeks of workshops for formerly incarcerated folks, in which you the formerly incarcerated participants are creating a monologue and narrative that is part of a rite of passage, culminating performance that kind of welcomes them back into their communities. And so this also engages, our teaching artists also engage in specialized training before starting this program, including, mental health first aid, trauma-informed practice, healing-centered practices, and some specialized training in working with formerly incarcerated individuals to kind of be prepared for holding that specific space. There's a lot of learning and training opportunity available for artists, and more to come. So there are graduate and undergraduate certificate programs available at multiple universities across the US. Many places are now also offering in-person or hybrid intensive trainings. New York City has the Creative Center that offers like a 3-day hybrid training. And the University of Florida Center for Arts and Medicine has a summer intensive. And then there's a lot of conferences and gatherings around this topic, many more than just, a few years ago when it was really the national organization was probably for Arts and Health was the only conference taking place. Now I see more and more spring up all the time. And we'll plug this again at the end with a QR code to save the date. But here in Newark, New Jersey, we're hosting the Creating Healthy Communities Arts and Public Health convening this October, which will be October 14th through 16th at NJPAC. And we hope that all of you will consider joining us as well. There will be registration opening in just a couple of weeks and lots of scholarship opportunities as well. Thanks to the New Jersey State Council on the Arts for their support there. One other thing I'd like to plug is that at NJPAC, we recognized that there is a gap for really affordable and accessible information about arts and health for artists and arts organizations. And so over the last 2 years, we've been developing a program called Access, which stands for Arts and Culture for Community Health, Education and Skill Building Series. And so these 3 first courses will launch this summer. Foundations will be a free 3-hour course. These are all online, asynchronous, self-paced. And so the Foundations course will take you through the basics of arts and health. Our other courses will be low cost, so $100 to take a 15-hour self-paced course. Arts and Public Health will explore pathways to infusing arts and cultural participation with public health outcomes in mind. And Arts on Prescription will go through kind of like the basics of arts on prescription, the origins, benefits, practical applications, and involves kind of worksheets and to workshop your own community-based model for arts on prescription. So these 3 courses will launch this summer. We're really excited about this actually coming to place. This is in partnership with Rutgers University and will be on their platform. And then 2 more courses launching this fall, which include healing-centered practice and empowering artists to develop evidence-based programming. And so both of those courses will also be about 15 hours and $100 a piece. And there'll be kind of, discounts for buying multiple courses, etc., or sequences and through the program. And our goal for this program is just to create a sustainable model that fuels more learning development. And so if you have an expertise in arts and health, like we invite you to submit your proposals for developing courses, and we will contract with artists to develop those courses as the program grows. So I think that might be, yes, let's see. Now we get to transition to Claire, which I'm so happy that we get to hear from Claire and her extensive experience in kind of training artists in health and healthcare spaces. So Claire, over to you.
Thanks, Allie. So great to hear all your information. I'm pleased to say that we agree on everything, and I'm hoping I can provide something that dovetails nicely with your really compelling case for the work of arts to support health and well-being. I just first want to say, Lady Breon, I can't say, when I hear you, it just gives me the shivers, and you're such a great example of the power of the arts to convey important health messages. I wish thousands of healthcare providers could hear you, could witness your performance. So thank you, thank you, thank you, thank you. Yes, so what I'd like to do is become a little more granular at the risk of boring, but a little more nuts and bolts about what does it take to be an artist in health. I have found over my career that when artists learn what an artist in health is, they self-identify. This is for me, this is not for me. And then I hope to also provide a little information about how you might become involved. I'm aware that many of you on this call might already be working in the healthcare system. That's wonderful. And our hope, I think Allie and my hope, is that it is a non-ending learning curve in terms of being an artist in health. So The next slide, please. Thank you. What is an artist in health? You had some great examples from Allie, but it's basically you're using your expert artistic engagement to support well-being and health. We're going to talk about healthcare settings, so hospitals, but it actually goes for public health settings, and I'm working in senior living communities now as well. So I would say hospitals are the focus of what you'll hear today. And you will know if it is for you as you learn about it. It doesn't require credentialing or certification. Hospitals mostly don't say you have to have taken a course. However, a good course will help you deliver optimal performance, optimal arts to the healthcare setting. So Allie gave you some great examples of gigs. I'll give you a couple more. These are mostly from my work at Penn State Health in their 5 hospitals and the Penn State College of Medicine. One is performers in lobbies. We do musicians. It could be dance. It could be some other types of performing artists. Another example is visual art commissions. These are visual artists whom we commission to create art pieces for specific areas in the hospital. And we have specific criteria for what those commissions might be. And we also develop print collections where we purchase the rights to use a digital image of a previously created piece of art for a fee. A very well-received arts and health gig is collaborative art projects, where a teaching artist comes in, holds a series of workshops for a group, a clinical staff group. They each make something small that the artist takes home and creates something large with. And that large something is then installed on the unit as a kind of metaphorical art piece of the collaboration that they all offer to support their work and patients. I just want to mention here that a lot of our artists in health work is for staff, because obviously the trickle effect, right? If we can support our healthcare providers, they can offer excellent care for their patients. So do you need training? Samantha, some of my, yeah, thanks. I was going to say some of them have animations. So not necessarily, but it's helpful, because if there's, especially in a hospital, if there's certain protocols and expectations that are not met, the personnel in the hospital could dismiss the art. The art can cause tension. It could even do damage in certain situations. So it helps. And a lot of it is intuitive. You'll just know what to do and what not to do, but not all of it. And it is all teachable. So that's the great news. You can learn. Once you learn that you're somebody who is a good fit for this, you can learn what you need to learn. I am going to give you an example of a training, again, a little bit more granular. Allie shared many wonderful trainings that they're offering, and I'm just going to share a little bit of detail of the training that is offered at Penn State College of Medicine. Like some of Allie's, the NJPAC trainings, this one is online, asynchronous. Ours is 8 modules. It takes about 15 hours. It's interactive, so you learn from your cohort. We offer an overview of the field of arts and health, and then 8 specific modules, and then a capstone project. Upon completion of the course, you get a certificate that says you completed the course. It's not a guarantee for employment anywhere. Our idea is, one more click, that it focuses on you, the artist, what we think will be helpful for you to know as you enter the healthcare setting. The first module is about sensitivity. It just provides a bit of a context of who is in the hospital. Why are why are, for what reasons are folks vulnerable and often emotionally charged in a hospital? And that's not only patients, it's also staff. And we also offer some guidelines on navigating interpersonal interactions ethically and respectfully. And we talk about the importance of trauma-informed care. We have an ethics code in arts and health. It is available on the NOAA website, and we kind of explore that, and we talk about how to make the experiences accessible to all, and all the while fostering a calm and positive environment. And where are the boundaries? What can artists in health? How much can we do? And how do we stay in our lane? Culture and inclusion is so important in artists and health work because hospitals serve all communities, and the arts engagements, in order to support people, must also serve all communities. We have the fourth module is about the scope of practice. And again, this is about the boundaries, and specifically, it's about music therapy, art therapy, drama therapy, all the creative arts therapies. Those are folks who are credentialed, who are, they're therapists who use their art medium to do therapy. They are clinicians. We are not clinicians. We provide art for the environment. Well, where are those boundaries, and how do we stay in our lane? We have a module about art in the physical environment. If you're being commissioned to create artwork for a hospital, what are the questions you need to ask? How do you interact with the art consultant, if there is one? What types of subjects might you consider as you're coming up with designs? What about an artist contract? And I just want to mention here that what we are really working toward in our field is that hospitals hire local and regional artists because they speak the best to the community. They understand the community, and they render subjects that patients and staff can relate to. So there are increasing opportunities, ideally, for visual artists to create work for hospitals. We talk about performance. How do you create a set list? The knowledge, the awareness that performances in general, usually, are, as Ali also described, in lobbies and public areas, you are enhancing the environment, but not, it's not an audience with applause in general. How do we include all the cultures, all the communities represented in a hospital? And what are the hospital's values, and how do we align with their intentions? Participatory art workshops, that's where we hire visual art teaching artists, like many of you on this call, to teach, to offer art instruction, a certain workshop. It might be an hour and a half or 2 hours. It might be a series. We talk about, how do you determine what the objectives are? How do you find out, do they want to build community? Do they want to offer a vehicle for mindfulness, a sense of completion that can guide you in your design of the course? How do you speak to all levels of artistic ability? Those of you who work in schools are pretty practiced at this. What word choices do we avoid in a clinical setting? Or what other word choices are really important in this setting? And how do we include all languages and cultures as we offer these art workshops? Hospital protocol. So when we say artists in health, that goes for that applies to public health settings, senior living communities. Perhaps The hospitals have the strictest protocols for obvious reasons. So HIPAA, that's confidentiality, is not all intuitive. Some of it we might not know when we start working in a hospital. So it's important to learn what that type of what those confidentiality practices are. Infection control and safety and patient experience, all mentioned by Ali also. These are all very learnable and not necessarily intuitive aspects of being an artist in health. Those are our 8 modules. As I said, we finished with a capstone project just because we find the joy in creating a project that has applied some of this learning, and we share it with the whole group. Those are really joyful meetings at the end, and then you have your certificate of completion. There are other courses. Ali had such a great menu of them. There are more. You can, depending on where you are. Ours that I just described is available to all Pennsylvania artists, professional artists. Unfortunately, that's the restriction for now. I would love to broaden it, and we're working on that. But there, you will find more, and we highly recommend you get some kind of training, to including trauma-informed care, to really bolster your toolbox when you enter the arts and health arena. I want to say a little bit about stipends, and I want to start by saying, please do not offer your professional artistic experiences for free. Artists are sometimes inclined to do that because it's so appealing to work in a hospital or a healthcare setting, and because it's hard to find funding. But I feel that every time that is done, you're doing your entire artistic community a disservice. We're working hard to fund all of these great programs, and we want you to get paid for your work. So when I was at Penn State Health and then currently in my LLC, I'm just going to share the stipends that we offer. You might find them low, you might find them high, you might find them middle, but I'm just telling you what we do. If you come in and teach an art workshop, a one-off art workshop for us, this goes in my senior living communities, and it was at Penn State Health, $250 for an hour and a half or so workshop that might, with additional for supplies at times, and that includes your prep time and your cleanup. But that's kind of what we settled on in the last few years. If we hire a musician or an easel artist to come in and just set up in a lobby and play for an hour and a half, it's $150 for a soloist and $275 for a duo. And visual art, it really depends. We really negotiate with the artist, so it's a fair market price. It is a price that makes them feel good and makes us feel good. And I can't think that I've ever talked an artist down. I think that we've been really able to be reasonable. The collaborative art projects that I talked about, where artists come in and do a series of workshops with a clinical staff group, and then take all of those products and take them home and make a large art piece, that will be higher. I would tell you that our art commissions have ranged from $3,000 to $50,000, but the usual for just a commission is probably, I don't know, $5,000, and then more up to 12 if it involves a bunch of art workshops and a collaborative art piece. I'd love to know your feedback on that, but that's where we are. Contracts. So this is, can be an uncomfortable or new zone for a lot of folks. I will say that when we hire folks for one-offs to play music in a lobby, or to create a painting in a lobby while people watch, and then they take the painting home with them, that we just do that in agreement over email. It's written, and we've all made, the artist has agreed, we've agreed, and that's the the paper trail we have. For larger projects, we have contracts, and that contract should protect both sides, you, the artist, and the institution that's hiring you. And those are some of the bullet points that are included in the contract: the description, the timeline, the payment schedule. What about insurance? And who's the contact person on the institutional side? All of these services are kind of what I'm doing now in my LLC. My job is really to support artists so that you can deliver these great services, and it's not scary or prohibitive. There are challenges, as you perhaps have gleaned, for an artist who may want to consider being an artist in health. And one is, not all artists want, it's not your thing as a performer to be environmental rather than a primary. You're not, and also artists who create beautiful work for our health. We have to accept our role as enhancers, not primary care. Certainly important and certainly meaningful, but we have to know that the medical care needs to be regarded as primary. We need to be in hospitals. We need to be comfortable around difficult health situations, people who are really not well, a child who has no hair and is dancing to your music while they're holding onto their infusion pole. It's emotional, certainly, but we need to be able to offer our arts engagements during uncomfortable health situations. It can be challenging to find gigs, to find arts and health programs. So you've heard of a few that may be in your area. Maybe they're hiring, maybe they're not, but how do you find other people who are prepared to hire artists? That can be a challenge. Compensation. How do you advocate for yourself that you get paid when somebody asks you to do something for free? That can be a challenge. And frequency of gigs. Wonderful. You get to play music in a hospital lobby one time. How do you work toward doing it more often, maybe once a month, different hospitals? So you are, for the most part, working in this field as a freelance artist. Some places, few, it's rare, but offer salaried positions, but mostly it's freelance work. And I think that many of you are familiar with freelance work, and that can be challenging. The joys, I listed 3. There are many more, but I want you to just know all of them loud and clear, these 3. You are making a difference. You will go home at the end of the day and know that you made an enormous difference in people's lives. You know it because you heard it, you felt it, you saw it. And aligned with that, you're witnessing the magic of the arts at work in general. The arts are powerful, they're magical. We have increasing evidence that they support health, and that's really important, but we know viscerally, and you will see that happen at arts and health gigs. Because it's emotional, because it builds community, because it does so much for people, you end up getting close to the people that you're doing it with or for. So your professional relationships are long lasting, and that is meaningful for all of us. Oh, I've got my contact in there, but it's very light font. But I think that's the bare bones of what I have to say. I could talk for hours because it's just such an exciting field. But Allie and I would love to hear from you, and Lady Breon perhaps as well. We'd love to hear from you. Questions, comments, anything else?
Yeah, thank you, Claire and Allie, both wonderful presentations, really great and helpful information. I think there's a lot of information for the artists on the call today to chew on, to think about. You've presented like really great opportunities that exist, sometimes free or for, a really minimal amount. And so we really are appreciative of that. I think it's important to not only provide information and context, but also resources and opportunities. I think that was really great. So thank you both so much. I believe now we are going to open the floor for questions, as you just said, Claire. And I believe in two different ways. You can either unmute yourself, like raise your hand, and we can unmute you, and you can ask a question, or you can type them, as some of you have already been doing, thank you, in the question and answer box through the Zoom interface. So we do have a couple questions already in the Q&A. And by the way, thank you, Samantha and Allie, for answering a lot of those questions that were coming through during the presentations. Much appreciated. But we do have a couple in there, and then we'll open the floor if folks have other questions beyond what's there. So we'll start with, do you have specific resources for finding artists who are already trained for healthcare environments? This is an interesting question because I think it might be different based on the state that we're in. Sometimes there's regional networks or lists, but sometimes they're state specific. So I'll kind of open that to maybe both Claire and Allie, but also Samantha or any of the other Mid-Atlantic arts and education colleagues that are on. You might have something that you'd like to share, but Claire, we'll start with you because I do know you have a Pennsylvania-based list based on the training you just shared with us.
Yes, so we have a Pennsylvania list. Jamie, I've also got great artists from you, from the Artists in Education roster. I am very aware that there's tons of artistic talent out there, folks that are not necessarily parts of arts organizations, not in the mainstream. I think talent is equally spread across all communities. It is, but not all communities have equal opportunity. So I do a lot of Googling and asking people, do you know people? Do you know people? So that I find some artists who are not on those more mainstream lists. But those are my ways.
Thanks, Claire.
Yeah,
Allie, did you want to
I
add
wish
something?
there were more lists. The NOAA website has a map, a feature where, if folks are a member of NOAA, you can find them on the map. And so that might be suggestive that they've, been working in this space or are working in this space. I know when I started at NJPAC, I was like, open to discovering the landscape of artists working in New Jersey. And we have such an incredible roster of teaching artists in our arts education department. At NJPAC, I looked to those folks first, and then we are kind of always having auditions. And so we started adding language about the arts and well-being programs to those recruitment processes for our kind of teaching artist roster. But I think that, that's an idea too, to bring towards like the access courses, is having like a list of folks who have taken those courses in the future.
Yeah, thank you, Allie. Does anyone else have anything they want to add about that? We can also follow up the different states, with information as well. But if not, I'm going to move on to the next question. Maybe they kind of fit together a bit. What might be a reasonable stipend for a performance gig, and how can folks find out about gig opportunities? So performance gigs specifically, because Clara, you had mentioned, some of the amounts that are provided for different artist engagements. So this was particularly performance, but then also, is there a place to find out about these gig opportunities for the artists? Again, could be national, could be regional or state specific. So
I'd love to hear what Allie says, and I'd also love to hear from Lady Breon where you, what you would suggest to artists, because it can be tricky. I think for artists, it's a bit of a barrier. How do you find the work? How do people find you? And again, I find artists through a lot of digging and connections, and I know I'm missing a lot. I want to know more artists, but I'd love to hear from the others.
Yeah, I would echo the same thing. I want to preface this by saying my specialty is not in art and health, but as a performing artist and having done some of this work, I think if I could be so assertive, sometimes you have to go and make the opportunities, right? So there are a lot of health institutions who they don't know they need this. You have to go show them the magic. So going and sort of pitching this opportunity, or when you find spaces where you're in situations where health professionals are there talking about your work, inviting them out to see things, it like shows them the possibility, which has been experiences for me. And then one opportunity begets other opportunities, and building the relationships and staying in contact ultimately can make, career long engagements, right? Like, residencies will last 10 years because they bring you back, every time they're doing one because they enjoyed your work so much. So I would just say doing the work, the networking, making the connections, and sort of pitching it can be a start. And it can be uncomfortable at first, but recognizing that a lot of places, they don't even know that like people do this, and they're like, wow, this is amazing. We absolutely would like to have a artist in our lobby. You know what I mean? So yeah.
That's a great point, Lady Brianna. And I think bringing along with that, like some of that evidence that Allie was sharing at the beginning, like the research to say, here are some of the amazing things that are already proven to work in these types of settings that connect to a person's health and wellness. So yeah, those are really good points. Another reason why some of our states in the Mid-Atlantic region, I know for sure, and I'm sure across the country, are doing a lot around like artists in business, like how to help artists and creative entrepreneurs think of themselves as, well, they are a business, and like kind of figure out concepts around marketing and promotion and pitching, because it can be uncomfortable, but it's okay. It's uncomfortable for everyone at first, and then you just get the hang of it and you get your spiel down more or less. And it just becomes part of how you present yourself and sell what you're able to offer. So that was a great suggestion. Thank you.
Yeah.
Allie, were you going to share something? Yeah, sorry.
I just echo all of that. And so when you do find through Google or other means an arts organization that is providing these services in partnership with healthcare organizations, it's an administrative burden to go out and find a new artist for every single program you're doing, right? So, for example, we have our public concerts in the hospitals now 3 times a month. So that's 36 gigs that we need artists for. So when an artist comes and performs well, is professional, is timely in delivering their invoices, is timely with signing their contracts, and like has that kind of professionalism and rapport with our administrative staff, we say, let's book that artist again, right? So like that kind of the business management as well as the artistic quality of it, so we end up, we have a few folks that we're, doing year-long contracts with now, that it's like, oh, so these are your, 10 gigs throughout these 3 hospitals over the year, because we know that you're going to, have a wonderful performance, and then also have that professionalism, and we know you're going to show up when you say you're going to show up, and the whole package.
And on this same topic, one of the questions that came in the chat connected to what we're talking about now, like, do we have any recommendations on how to promote health and well-being for artists who work in non-healthcare settings? I'll open the floor to whoever would like to respond to that one. So it's how to promote health and well-being for artists who work in non-healthcare settings. So is that question who asked it, is it for the health and well-being of the artist, you're saying? Or want to make sure I'm understanding the question correctly, sorry.
That's my question too. Is it the health and well-being for the artist, or just for the setting that's the non-healthcare
for the
setting?
students, it looks like they said in the chat. Thank you, Emily.
Yeah, that's definitely a component in all of our training is kind of self-care practices. How do you stay well? How do you focus on kind of, sometimes it's an alternate creative expression than your main modality, where you can kind of play and express yourself a little more freely than sometimes we feel. I know as a visual artist, sometimes I feel a lot of pressure to create something masterful every time I sit down to paint or draw, but I can, sit down at a pottery wheel and relax, right? So that's a component of a lot of our training. And then another component of that is really that boundary and ethical practice helps you stay well, right? So that when you're showing up in these spaces and working with people who may be in different vulnerable capacities, that you can maintain your mental health in those spaces too. But I'll pass it to Claire and Lady Breon.
I don't have anything to add to that. I agree. It needs to. I will say that my experience has been that artists know very well how to do self-care. They just need to remember to do it. But they have this wonderful menu of arts engagements that feed them. It's just so easy to forget to feed yourself. And so we have to be reminded.
Yeah, good point. Thanks, Claire. Lady Breon, did you want to add anything? I don't want to skip over you. You good? Okay. Claire, while I have you though, one of the other questions in the chat was, could you share the link for that training program you were talking about? The one with Penn State Health. At some point, or we can follow up even with an email to folks, whichever.
Yeah, I'll just do a little online stuff now and figure it out and then send it to you. Yep.
Yeah, sure. No problem. So here's a question that this might pertain to you as well, Claire. Which departments within the hospital manage the artist engagement? Maybe that depends on the hospital. Which types of hospitals are more likely to hire artists?
Oh, that's so. I wish I could respond and say all artists have arts and health programs and they're easy to find and this is how, but that's just not where we are yet. So Allie can share where in the hospitals. I'm going to tell you how it is and I'll tell you what I dream. So how it is in our hospitals, the 5 that I worked, there was an arts and health program in the College of Medicine. So they had to find us. And we often found them. I know also of hospitals that do it through their facilities department, others who do it through their patient experience department, and others who have a totally freestanding arts organization within their hospital. What I would love to move toward, and Allie and I have talked about this, is hosting arts and health programs at arts organizations, and then we, the arts organization, place, kind of like what Allie's doing, place artists across the hospitals. But Allie, what do you think?
Yeah, I've been a part of different mechanisms. So like at New York City Health and Hospitals, there was a centralized arts and medicine department, but depending on what hospital you wanted to reach, there was also, the Creative Center providing artists and residents, and Sing for Hope providing musicians, kind of different organizations contracting with the hospital system. Or at Moffitt Cancer Center down in Florida, we had an arts and medicine department and a whole open studio and a whole physical space for us to live and program out of. The model that we're doing at NJPAC is that the arts organization is serving as the hub for hiring, teaching, training all of the artists, and we provide those services to the hospital through coordinating with, sometimes it's public affairs, sometimes it's social impact, sometimes it's patient experience departments in the hospital to deliver the programs, but that the artists themselves actually just have to interface with the arts organization to be a part of those programs.
Allie, I wonder whether it's an arts organization on the call or teaching artists themselves. I don't know, coming at it from like a sales point of view, I guess making at least some initial contact with the hospital, explaining what it is, because it sounds like it could be very different depending on the hospital. Are you in public affairs? Are you in College of Humanities within the hospital? It just varies. So maybe just making an initial point of contact with someone in my gosh, I don't even know, maybe the facilities department, and then they can direct that artist or organization through the right channels, or is there like a good starting point if people don't know where to begin?
Can like see Claire's eyes and be like, if you're lucky, you know,
I mean,
if you're
I
lucky.
love
know.
I love this discussion because this is the barrier. This is hard,
Mhm.
and this is what I feel dedicated toward helping helping this to move along. But I think someone like Allie or me is very good at interfacing with the hospital and finding those key people. I think it's really hard for an artist to just enter a hospital, email someone and say, hey, I do this really great art and I'd like to, and research shows it's just, unfortunately, or whenever, that hospitals more and more are corporations, they're health systems, and they don't necessarily have bandwidth to respond to an individual artist. So I would say keep in touch with Allie, keep in touch with me. I hope I have great news within a year of at least in our area of Pennsylvania being able to find gigs through an arts organization that places you in hospitals. For now, you could cold call a hospital. I'm not saying don't do it. I'm just saying please don't feel bad if it doesn't bear fruit.
Yeah,
Yeah.
yeah,
And
that's a
I
good
would
point.
say, yeah, just like in terms of like if you're into sleuthing, right? If you're into this like kind of discovery process, the reason why or how our relationship with RWJ Barnabas, health system started or with Horizon Blue Cross Blue Shield is as a sponsorship relationship. So if you see, I'm using New Jersey and not ours, but Hackensack Meridian Theater, right? That exists. Oh, there's a relationship there. So if I have maybe a better chance of getting a response or, getting a 20-minute Zoom with someone at that arts organizations to talk about, oh, I see you have this funding relationship. Is that also a programmatic partnership? Are you providing, any music for that hospital system? Because I'm a musician and I love to play in healthcare spaces and I have this expertise or training or repertoire. Like that could be perhaps an easier in than, the kind of varied landscape of a healthcare system. And also like just the nature of working in now I'm in a performing arts center. I used to work in the largest public health system in the US and with like New York City Health and Hospitals, and just knowing just the practicality of whether or not any email gets a response or any call gets a response, depending on the kind of prioritization of like an internal person, an external stranger, or like if someone doesn't know the answer, they might not, have the time to find the answer for you. But an arts organization might be inspired by that proposal and say, I have someone that we work with quite frequently over there. Let me, try to make that connection for us.
That is a great suggestion. I love that. I think if I was in the shoes of an artist, that's a great suggestion, and could begin a relationship or a partnership even with that organization that they, weren't considering. So that's great. Thank you. So there's still some questions here in the Q&A. This next question, do you think there is a path forward to move from a freelance market towards sustainable salaried work for artists in health? So not the gig work, but full-time salaried work. While this work presents a fabulous opportunity for us to differently apply our gifts in service of health and well-being, the freelance nature of it seems to signify a lack of value for the work, especially when considered alongside the salaries earned by healthcare workers which they might be partnering. Perhaps this is actively shifting as the field develops, but the person is just curious, how might we work to change this? And what are the affordances and limitations of such consideration? That's a big question, but I mean, I get it. Yeah.
Allie, go ahead. I'll go after you.
Yes, I think there is a path forward, and it also depends on like how the artist wants to structure their employment, right? So there's different models for this. At the University of Florida, Shands Hospital, they have 24 artists on staff delivering arts programs to the hospital system there in Gainesville. Most of those artists are contracted for, somewhere between 16 and 25 hours a week so that gives them the agency to continue to live their lives as an artist and to have their professional gigs outside of the hospital. And so like the kind of regular income from their hospital-based work provides a basic kind of safety net and regular income, and they continue to do, their either conceptual artwork, visual artwork, or music performances, etc., touring with their bands and so on and so forth. At NJPAC, we've been able to bring on as part-time staff our artists in residence, because those are regular gigs, and our teaching artists that work in like the Lullaby Project and Ritual for Return, and there's one other one I'm forgetting, but so that are on more of a regular contract. And we try to return to our performing artists that do the music in the lobby, so that they can know that, like, once a month, that this is a dependable source of income for them. And so I do think that there's a balance between like who wants to do this, or really the capacity to do this as a full-time employment opportunity too, knowing that it is a little bit higher emotional bandwidth to be holding space for people in these various vulnerable populations, especially within healthcare spaces or kind of post-acute situations too. But I do think that's shifting, and then there's a lot more opportunities for arts and health administration, so roles like mine, and I have 2.5 I have 2 full-time staff members on my team and a half-time staff member, and that team will be growing as we grow our program at NJPAC. And maybe there's a mix of artistry delivery and administration to be had.
Yeah, that's a great point. And thinking about it, like, are you a part-time or a staff member of the arts organization or of the healthcare institution that you're working with? And it could go, in either direction, certainly. Claire, did you want to add anything?
I agree that probably the best path forward would be an arts administrator. So you're offering your arts engagements as part of your, in addition to administrative duties. A full-on artist, we hired them, as Allie is describing, maybe it was some of them were once a week they would perform in our lobbies. So that was a little bit more. I think what you're looking for is a reliable income, and that was more reliable income for our artists. I will say that for hospitals to offer salaries to artists is not really realistic, because although there are wonderful hospitals who do it, they are outliers, and we can't expect all hospitals to follow suit, because they are constantly being criticized for all of healthcare costs. And if somebody was waiting too long for an appointment, and there are these artists on salary, it's very difficult for the hospital administration to justify. You and I, everybody on this call, would have something else to say, but they're being run as a business. So I think that's not a place to push this path forward. I think the path is through arts organizations and to allow the arts and health administrators to place hospitals. That's what I'm thinking.
Well, kind of on this, while I have you on, Claire, one of the next questions connects to this a bit too. Are there teaching hospitals that are starting to offer the arts and health programs? And Penn State Health was a teaching hospital. Do you see more examples like that kind of work is happening in those institutions?
Allie might know of others. Ours, is a teaching hospital, and that's, I think, why the arts and health training was so warmly received by the College of Medicine. I don't know, and I taught medical students art as self-care, and that was really well received too. So I would say in our area a little bit. I wouldn't say, oh, there's this great increase. I think the work is on us to advocate and grow these opportunities. Allie, what do you think?
Yeah, I think what you were just touching on that, a subset or, allied field to arts and health is medical humanities. And so that's using the arts and arts programs to train our, health providers, whether it's nurses, doctors, anyone, and how the arts can be used to help observation skills and cultural competency and, um, a whole host of benefits. And so I think that's like that I see is growing, and it's still really tough, right? Like, the feedback that we get from, curriculum developers for medical professionals is that, there's not enough hours in the curriculum already, and you want me to put an arts course in here. But the evidence does show that it helps us make better doctors and physicians and nurses and team members. And so I know at New York City Health and Hospitals, most of all of the arts and medicine program is actually focused on staff and staff learning and staff well-being and burnout prevention and communication, cultural competency, et cetera. So yes, I would expect, teaching hospitals to be a place of innovation and a place for opportunity. And sometimes if you can't make the argument for direct patient access, that, staff and healthcare professionals is often like a kind of considered safer population to work with, and maybe a way in, a foot in the door.
There's only one more question in the chat. I know we have 1 minute. So even if you just give a quick little, hey, this might be helpful. And it's kind of a nice way to wrap it up. How are these programs that we're talking about today being evaluated and assessed in these different healthcare settings to show that like having an arts and health program is helping people with healing and wellness? And with that, I'd add on to that. Are there tools out there already that maybe people can access, or reports that people can see as part of their initial conversations when they're pitching maybe to different organizations or healthcare facilities?
I'll do mine in 5 seconds. Yes,
Yep.
evaluation is really important. Every single program is evaluated or needs to be evaluated. And yes, there are ways for standardizing evaluations and sharing them.
Awesome. And I see, Allie, you put that in the chat too, the framework by Daisy Fancourt. Thank you. Did you have
Yeah.
anything else you wanted to add quickly?
Just that in the same way that Lady Breon's story told us more about arts and health than, a PowerPoint or did, getting testimonials and, stories about people's experiences, engaging in the arts for their health and recovery and well-being is often, just as important as the kind of numerical data, that we get from scales pre and post. So combining those two is always really great for storytelling and using the arts for telling the story.
I'll also share in the Q&A. Both Allie and myself have listed a half dozen resources, so websites, organizations, books, studies, things that you can find some of these facts and research to support the work that you're doing. So we're nearing the end of our time together, and I'd just like to take a moment to thank both Claire and Allie, as well as Lady Breon, for sharing your vast knowledge and expertise with us. We are so grateful. I'd also like to thank Jamie and our other colleagues at the Mid-Atlantic Arts Education Working Group, most of whom are here today. Thank you so much for helping support make this webinar happen.
Yeah, and I would just like to echo, yes, thank you everybody so much. The panelists, Allie, Claire, Lady Breon, like amazing, amazing session. It's been wonderful being able to share all of this, especially on at least here a gloomy Friday. It's been very uplifting and inspiring. And, we'd love to have feedback from all of you on what you thought about today's webinar. If there are other things down the road you think would be helpful as a teaching artist or an arts administrator, please let us know. Samantha, or do we have a survey or no? I can't
Yep,
recall. Okay, sorry.
the survey link is in the chat, and
Oh,
also
perfect.
it's been asked a bunch of times. Yes, you will get this recording. Yes, I will copy all of the links and share it out with you. And yes, I will ask both of our presenters if they don't mind sharing their deck, and if they don't, I will share that out with you as well.
Awesome. So thanks, everybody. Check out the link in the chat and have a great weekend.
Thank
you
you.
so
Take care.
much.
Thanks,
Bye.
everyone.
Thanks for having
Yeah,
us.
everybody. Bye.
Yeah.